Hi, how are you? Welcome to another question and answer session. This is the question. A 70 years old man is due to undergo an arterial bypass procedure for colonication and foot ulceration. The anterior tibial artery will form the site of distal arterial anastomosis. Which of the following structure is not closely related to it distally? So, first of all, we have to find out the main point from the question. From where they want to know that the anterior tibial artery distal arterial anastomosis, and they want to know about that which is not closely related distally. That means distally to anterior artery, which structure is not closely related to it. Here the options are interosseous membrane, deep peroneal nerve, tibialis posterior, extensor hallucis longus, and dorsalis pedis artery. So first of all, we have to find out the anterior tibial artery and the distal part of anterior tibial artery and their different structure. So here first of all, this artery, this red structure, which is the anterior tibial artery, and distally to anterior tibial artery, here the different structure present. Here first of all, here we can see a nerve is very close to anterior tibial artery, which is the deep peroneal nerve. So deep peroneal nerve is closely related to the anterior tibial artery. Then here we can see some other tendinous structures, such as this is the extensor hallucis longus, then extensor digitorum longus, and some other structure, and also here the dorsalis pedis artery. So here in this picture, this is a artery, and this artery is the anterior tibial artery, and the anterior tibial artery is closely related to a nerve structure, which is the deep peroneal nerve or deep fibular nerve. Here this is the deep peroneal nerve, and then we can see the interosseous membrane. It presents both proximally and distally here. So this is the interosseous membrane, which connects the tibia with the fibula, and the other structure present here, such as the ankle joint and some of the ligament of the ankle joint. And the distally, the anterior artery, it continues as a dorsalis pedis artery. So here we can see this is the anterior tibial artery, and distally is continuous as a dorsalis pedis artery. And here we can see this some other tendinous structures, such as that this is the anterior tibial artery, this is the extensor hallucis longus, here the extensor digitorum longus, deep peroneal nerve, interosseous membrane, and here these are the tendinous structure or retinaculum also present, which is also related to this anterior tibial artery. But on the other hand, here we can see the posterior leg structure, such as this is the posterior tibial artery, this is the tibial nerve, and the muscle which is present in the posterior compartment of the leg, they are not related to the anterior tibial artery. So here another structure, we can see this is the tibialis posterior muscle. Here we can see this is the tibialis posterior muscle, and some other muscle in the posterior compartment which is not related to the anterior tibial artery. So our final answer, it is now the tibialis posterior. Tibialis posterior, it is contained in the posterior compartment of the leg, and which is not related to the anterior tibial artery. Other structures, such as the interosseous membrane, is closely related to the anterior tibial artery. Deep peroneal nerve, it also related. Extensor hallucis longus and dorsalis pedis artery, they are also very close to the anterior tibial artery. But the tibialis posterior, which is structure in the posterior compartment of the leg, is not related to the anterior tibial artery. Thank you all.